A warning from Ontario Public Health. Between October 1st and December 31st, invasive Group A strep killed 48 in the province, including 6 children under 10 years old. The bacteria is commonly known for causing strep throat, but is behind other skin infections as well, like necrotizing fasciitis or flesh-eating disease. The agency pointing to an uptick in the number of cases overall.
So we look at October to December 2023, and we had, based on the data available for our PHO Public Health Ontario report, we had 540 cases, and you compare that to just over 300 over that same 3-month period in 2022. So certainly, a considerable increase over that 3-month period compared to just a year before.
With strep infections, the most common places that we see them would be cellulitis, so just an infection of the layer just underneath the skin, or strep throat.
Dr. Dale Kalina is the Chief Medical Information Officer and Infectious Disease Specialist at Brant Community Healthcare System in Brantford. He says this uptick in cases fits with the disease's long documented history of ups and downs in prevalence among the public.
And those changes can be very easily felt because it can be such a tragic infection, of course. At the same time, as we, I think, all know, strep infections like strep throat, for example, are very, very common. And that really does highlight the fact that Group A streptococcal infections are very, very common. And it's important to watch out for some of those kind of red flag warning signs.
If you're looking out for yourself, if you're looking out for your kids, what are some of those red flags that you talked about?
Particularly as it pertains to these invasive Group A streptococcal infections, are the rapidity of worsening. So not only of that redness and the pain that you would see in, say, a skin or soft tissue infection, but also the speed with which that area changes. The other aspect to watch out for is a change in people's overall health. Are they appearing tired, lethargic, feverish, things like that?
Dr. Kalina says those red flag symptoms tend to be similar with adults and children, but adds with infants, things like producing enough wet diapers as well as food and water intake should be watched as well. He says if you think you or a family member may have contracted the disease, it's cause to see your healthcare provider.
It's what I would do.
Ontario Public Health also telling us this is the highest monthly case count reported since 2015. For City News, I'm David Zura.